Hello, my name is Ryan Doran, and I'm a nursing student at the University of North Carolina at Pembroke. And today I would like to talk to you about an important topic, flu vaccinations, or as we often call them, flu shots. This year more than ever, we must remain vigilant when protecting ourselves and those around us. This is due to COVID-19 and the severe strain that it's placing on our healthcare system. After watching this video, you should have an understanding of what the flu is and the benefits of taking the flu shot. You will learn why it is important to be vaccinated for the flu annually. We will discuss the safety of the flu shot, and you will also learn about side effects associated with the flu shot. Also, after watching the video, you should know when you need to take the shot and where you can gain access to one. Finally, we will show you the actual process of getting the flu shot. The flu is a contagious respiratory illness that is caused by influenza viruses. They can infect the nose, throat, and sometimes the lungs. It can cause mild to severe illness and at times even leads to death. The best way to prevent the flu, get a flu shot. Flu symptoms can be mild to severe and they also lead to death, as we discussed a moment ago. The flu is different from the cold. It usually comes on suddenly. People who have the flu often feel some or all of the following symptoms. They have a fever, they could have chills, cough, sore throat, runny, stuffy nose, body aches, headaches, fatigue, and some people may have vomiting and diarrhea, although this is more prevalent in small children than it is in older adults. It is important to note that not everyone that has the flu will have a fever. Keep in mind some of the complications that are associated with having the flu. Bacterial pneumonia, ear infections, sinus infections, worsening of chronic medical conditions such as congestive heart failure, asthma, diabetes. One of the main reasons we get a flu shot is prevention. During seasons when flu vaccine viruses are similar to circulating flu, the flu vaccine has been shown to reduce the risk of having to go to the doctor by 40 to 60%. Flu vaccine can reduce the risk of flu-related hospitalization for children, working age adults, and older adults. The vaccine has been shown to prevent tens of thousands of hospitalizations each year. Just take 2018-2019, for example. Those that were vaccinated, this helped prevent an estimated 58,000 flu-related hospitalizations. Another study showed that from 2012 to 15, adults that were vaccinated had an 82% reduction in ICU admissions. This is an important preventative tool for people with chronic conditions. The flu has been associated with lower rates of some cardiac events, especially among those who have had a cardiac event in the past year. The vaccine has been shown in several studies to reduce the severity of illness in people who get vaccinated but still get sick with the flu. Another 2018 study showed that among adults hospitalized with flu, vaccinated patients were 59% less likely to be admitted to the ICU than those who had not been vaccinated. Among the ICU patients with flu, vaccinated patients on average spent 4 fewer days in the hospital than those who rejected the shot. The flu vaccine also helps protect pregnant women during and after pregnancy. It reduced the risk of flu-associated acute respiratory infection in pregnant women by 50%. Another 2018 study on the seasons 2010 to 2016 showed that getting a flu shot reduced a pregnant woman's risk of being admitted with flu by 40%. It also showed that in addition to protecting the pregnant woman, the flu vaccine given during pregnancy protects the baby during pregnancy and several months after birth. This is important because babies can't be vaccinated. Getting vaccinated yourself protects those around you, those that are most vulnerable to flu, like babies, young children, older people, people with certain chronic health conditions, your grandparents. Despite the many benefits offered by flu vaccine, only about 50% of Americans actually are vaccinated. And it continues to cause millions of illness, hundreds of thousands of hospitalizations, tens of thousands of deaths. Many more people could be protected from flu if more people got vaccinated. So why is it so important to be vaccinated each year? Well, the virus is constantly changing, so the flu vaccine has to be updated from season to season to protect against the current virus. Research suggests will be common during the upcoming flu season. Your protection from a flu vaccine declines over time, so yearly vaccination is best for protection. Is the flu vaccine safe? Yes, it is safe. Flu vaccines have a good safety record. Hundreds of millions of Americans have safely received the vaccine over the past 50 years. Extensive research supports the safety of seasonal flu vaccines. Each year, the CDC works with U.S. Drug Administration, FDA, and other partners to ensure the highest safety standards for vaccines. More information about the safety of flu vaccines can be found at www.cdc.gov. What are the side effects of flu vaccines? Flu shots are made using killed flu viruses or inactivated viruses without the flu virus at all. So you cannot get a flu shot. It will not give you the flu. Some minor side effects include soreness, redness, swelling where the shot was given, low-grade fever and aches. The nasal spray, they're a weakened virus and they do not cause the severe symptoms associated with the influenza illness. For adults, side effects from the nasal spray may include a runny nose, headache, sore throat, and a cough. For children, some of the side effects may include wheezing, vomiting, muscle aches, and fever. If these problems do occur, they're usually mild and go away on their own. Serious reactions are possible though. Although most people who receive the flu vaccine have no serious problems from it. When should you get vaccinated? Generally by the end of October. However, as long as flu viruses are circulating, vaccines should be continued throughout flu season, even in January or later. Vaccines are offered in many doctors' offices and clinics. They're available in many other locations, health departments, pharmacies, Walmart, urgent care clinics, health centers, travel clinics. They may be offered at your school, college, health center, or even your workplace. Visit vaccinefinder.org to find the nearest location in your area. Now that you've learned all about the flu vaccine, let's see it in action.
All right. You've not been sick recently, have you? Like with a fever, cold, or
No.
anything? Okay. All right. All right, gonna feel a poke. Burn. You're all done.
Thank you so much.
That wasn't so bad, was it? As you can see, the vaccine actually takes about 30 seconds. It's relatively pain-free. It's a pretty small price to pay for the potential of saving lives, including your own. Just to recap, we now know that all adults should protect themselves and others by being vaccinated. The flu is a respiratory virus. It can cause severe symptoms and death. We know that the vaccine is safe and it has minor side effects, if any. Most importantly, you know when and where to get vaccinated in your area. So let me encourage you to get out there and roll up your sleeves.